Concerns over coronavirus and in our area are growing. This as the World Health Organization now says the global risk of coronavirus spreading is very high. CBSN New York's Reena reports.
It's time to prepare. It's time to get ready. It is time to act. And people need to take a reality check now.
Hospitals and health professionals are gearing up as the World Health Organization announces it's trying to keep the virus contained. Facilities across the world having trouble keeping up.
Our determination right now is that health systems around the world are not ready and need to be better prepared to absorb the impact.
Experts say the average American should be getting ready too, with top officials warning things will likely get worse.
There will be quarantines in this country. It's not if, but it's when and where. And we're all going to have to prepare for it.
Dr. David Agus tells CBS This Morning that means know your company's work from home capabilities. Be aware your kids may have to school at home and stock up on a week's worth of dry food.
There's going to be a new way of life.
And what about the possibility of New York City schools being shut down?
But even though that's something that is in our back pocket, we would think long and hard before disrupting the lives of New Yorkers. We don't take those measures lightly.
This as health officials in California work to figure out how a woman there contracted the virus with no link to foreign travel. Both hospitals where she's been treated are near Travis Air Force Base, where hundreds of Americans returning from China and Japan were quarantined. But officials found no connection between the woman and anyone there. They are trying to track down anyone she's been in contact with. She had symptoms days before she was diagnosed.
Which means that there were multiple healthcare personnel who were exposed to the individual. Some of them are under isolation, some of them will be under quarantine.
Experts say right now there is a lack of testing kits, but next week there should be more tests in this country and more testing places. You are urged to see a healthcare professional immediately if you have any flu-like symptoms and have visited any affected areas. Meantime, we are expecting to get results on that possible New York City case in the next day or two. In the newsroom, Reena Roy, CBSN, New York.
And as we have yet to see any confirmed cases in the tri-state area, our local hospitals are preparing for them. Mount Sinai, Brooklyn, one example. On arrival, patients are asked about their symptoms. If nurses detect any risk of coronavirus, the person is immediately taken to an isolation room to limit exposure to others in the waiting area. Any doctor or nurse in contact with the patient will wear special protective gear, including a respirator mask, face shield, and gloves.
The way we have been actually preparing for almost several weeks now is that it is going to happen.
If it's determined the patient needs to be tested for coronavirus, results would be expected to take about 48 hours.